Hey everybody, it's David. I'm your host of Highway to Health podcast series, and we can't thank you enough for being here. You know, by now, you obviously understand that this show is meant to discuss this open road journey that we're all on to improve patient access to care, their experience while getting that care, and then ultimately impacting and improving the outcomes for our patient population. And we understand it's going to take a village, and that's why this show is meant to celebrate the innovators, the disruptors within the healthcare industry that are bringing the good work to the industry to make that impact, to make that improvement. And today we're going to talk about value-based care and bundled payments and what that means and how that impacts not only the patient community, but the provider community, and how this village is coming together to improve all of those things that we care so deeply about. And that's why I'm really excited to have Brooke West, who's the Chief Commercial Officer at Carrum Health, and Christoph Dankirk, who's the Chief Network Officer at Carrum Health. And we're going to talk about those things that I just mentioned. Before we get started, I want to welcome our guests, Brooke, Christoph. Welcome to Highway to Health.
Good to be here.
Thanks, David.
Yeah, thank y'all. You know, before we get started, this is kind of a tradition of mine. And if you feel comfortable, you know, really quickly, we're going to cover a lot today. So maybe 30 seconds or less. Brooke, we'll start with you. Will you share a healthy habit that you've implemented in your life to maintain that mental and physical health that's so important for not only your work, but also your loved ones?
Yes. So I'm part of the 5 a.m. club. If I'm being honest, it's probably more like 4:30 a.m. club. I work out probably 7 days a week, most weeks. I plan my meals, but maybe the most important thing that I do is what I call taking mini vacations, where if I find 5 minutes to sit in the sun, I enjoy the heck out of that 5 minutes. And I call them my mini vacations.
That's good. Yeah, the vitamin D and being outside. I'm a big fan of the outdoors as well. Christoph, what about you?
Yeah, I'm a big fan of the outdoors as well. I'm also a big runner. And so what I've implemented is a couple of days a week to go on a run. And we have 2 young kids, so that now involves pushing a stroller up and down the hills. And there's nothing better than that in the morning. You know, you get energy, you're outside. It's a really good way to clear the head.
I agree. It's the best cup of coffee you can have to get that morning workout in and get you going for the rest of the day. I appreciate you guys sharing that. Brooke, you know, I want to start with you because there's folks out there, some of our listeners that may not be familiar with Carrum Health. And so if you don't mind setting the stage for our listeners, share with us the Carrum mission and why your team is so passionate about bringing this type of disruption and value to the healthcare ecosystem.
Yeah, thank you for the question, David. Probably my favorite one of all time. So our mission is to really change how healthcare is paid for and delivered. We have all experienced varying degrees of healthcare. A doctor's visit, a procedure, a major surgery, you know, you name it. We've all experienced it. And we've also all experienced really a never-ending stream of confusing bills, challenges navigating the healthcare system. And as a patient, we really have no way of determining quality. We trust our docs, trust that procedures or surgeries are medically necessary when actually 25% of the time they are not. The costs continue to go up, you know, more than 6% this year with really no correlation to quality. And employers and their populations, they really bear the brunt of it all. So we're looking to change all of that. And we're passionate about it because, quite frankly, people deserve better. They deserve to have the highest quality care, no matter where they live, at the best cost, you know, all wrapped in a great experience. It's really, from our perspective, a basic human right. And we need a model to enable those results to optimize, you know, equally for the patient, the provider, and the employer.
Yeah, you know, Brooke, I think you're exactly right. And I think we all have a personal experience when it comes to this. We're all patients at the end of the day. And if you don't mind, would you share maybe a personal experience that you've had that showed you why choosing the right physician is so important for the experience and the outcome of our care?
Yeah, thanks for the question, David. I've always been passionate about Carum since, when I was in the interview process, and that has not changed. But last December, it got personal. So my father was diagnosed with pancreatic cancer, and it had spread to the liver. From diagnosis to death, it was 13 days. I was in the hospital with my father and my mother, and when the hospital assigned an oncologist for my father's case. And poor guy didn't know who I worked for. The very first thing I did was I texted Christoph, and I said, "Can you please look up this oncologist's quality data? I wanted to know who we were dealing with here." And the first word in the text back to me was "run." This
Wow.
oncologist has never seen a pancreatic case, not one. But he had incredible bedside manner. He spoke so that my mother could hear him. And that was how my parents were kind of evaluating how great of a doctor this doctor is. So I was working behind the scenes, that we got a referral, and I asked the same question to Christoph. The second oncologist had seen exactly 3 cases of pancreatic cancer. So these aren't exactly the types of volumes that you're hoping to see in such a dire situation, and that's when, thankfully, Christoph said, "Okay, stop, let us take over here." And he got us to really the premier specialist in pancreatic cancer. And while we did not get the outcomes that we were hoping to get, what we did get is a little bit more time. The original oncologist had scheduled my father for chemo, put the port in his chest and everything. And once we met with the specialist, we then knew that had we proceeded with chemo, my father would have died instantly. The cancer had spread. He was that far gone. The chemo would have killed him instantly. And he would not have seen my brother, my sister, my daughter, in his final days. So it matters. It really, really matters. And most of us, we don't know. We don't know what the quality is. We trust, there's a culture in our country of trusting the doc. And, we are not always getting the highest quality care that we possibly can. And, we're here to change that.
That's, man, what a powerful story. And you're so right. We're so trusting. There aren't many places. We're all humans, and human nature says to be not as trusting. But at the doctor, with your physician in that setting, that's one of the few places where we almost by default accept that direction and that guidance that we're getting from the healthcare professional, because we're not the expert in that setting, and they're supposed to be. So you have a direct line to great resources like Christoph. If you don't mind, help us understand how Carum helps the patient navigate that process if they don't have Christoph's cell phone number.
Yeah, absolutely. And oh my gosh, in that process, did I have to check my privilege in a million different ways? And it really, again, I've always been passionate about Carum, but now it's a personal mission. It's a personal mission to get, Carum in the hands of every employer so that we can help every single member of their population that needs our help, that, deserves to get the care that, the high quality care that they need. So that is what Carum is doing. So we are directly connecting providers with employers. We're pre-negotiating all-in upfront prospective bundles where every single piece of the episode of care is negotiated into one lower rate. These are negotiated with the highest quality providers in the country. So Christoph and his team apply a quality evaluation methodology that is a level of rigor that you're just not going to see anywhere else. So we know through years of data and evidence that this is a group of surgeons who, if left to their own devices, they are going to provide the highest quality care and the most appropriate care. Meaning, sometimes surgery is the right thing. Sometimes it isn't. So this is a group of surgeons who are going to ascribe really that most appropriate care. But we don't leave them to their own devices. We negotiate these all-in upfront prospective bundles. We align incentives for appropriateness, and then also have every provider on our platform commit to a warranty against readmissions, it's phenomenally unique. You're just not going to see that anywhere else. And so now you've really got kind of a vehicle to deliver value-based care. Start with the top 10% of surgeons in the country. Negotiate all-in upfront prospective bundles. Align incentives for appropriateness, in the event where surgery is not the most appropriate path. And then have every surgeon commit to a warranty against readmissions. Just because they're the top 10%, it doesn't mean that a warranty isn't necessary. It's similar to, I've done all my research and I bought the safest car in the market. So therefore I don't need to wear a seatbelt. We would never do that. Of course you're going to wear a seatbelt. And so that's why these, every single piece of the elements that we implement in our contracts with our providers, including the warranty, are just so important. Now, all of that is the care that we're going to deliver. How it happens with the patient is through our care concierge team. So our patient care specialist is going to hold the patient's hand. Think of it as like a valet, first class care concierge type of a model. Hold their hand and do all the things that we as humans on this planet can't stand doing in the healthcare process. Those phone trees that we get lost in trying to navigate care, find the most appropriate care, scheduling, medical records collection, everything in the process from beginning to end. Our patient care specialist team is going to hold their hand and get them through it in a really phenomenal way.
You're touching on something that I think I've become more and more aware of. And I think this is kind of the next step for our patient community to improve access, experience, and outcomes. And that's avoiding unnecessary levels of care, or maybe finding alternative or non-traditional therapies that can improve access, improve experience, and get you the outcomes that you're expecting. Part of that is avoiding surgery. And you talked about readmissions and decreasing those. Oftentimes those are tied to a procedure. In your opinion, is that the biggest barrier to care? Maybe even more complex or specialized care? This fear or the cost of a big surgical procedure that might be potentially avoided if you were to look somewhere else or go down a different path?
I think that generally the biggest fear, the biggest barrier to care is going to be around cost. If there isn't something that's life-threatening, there's but it poses a large cost to the consumer, to the patient, there's a good chance you could push it off. You're going to push it off, or skip it altogether, which, presents all kinds of downstream risks, for your life. But cost is absolutely the biggest barrier to care. I don't actually think that and Christoph might have a different opinion, but I don't think that patients have an awareness that unnecessary surgeries are happening.
Right.
If you've had a knee replacement or a bariatric or a spinal fusion, at the end of it, are you like, I wonder if that was necessary or not? Probably not. Because like we were just talking about, that trust relationship that, that patients, consumers just kind of blindly have towards their provider, towards their care provider. If they're told that they need to have this surgery, they're probably going to do it. And they're probably, they might seek a second opinion, but they probably are not going to say, I wonder if that was necessary or not.
Yeah. It can sometimes feel like, to add to what Brooke was saying, David, it can sometimes feel like it's the easy button in a way, right? Oh, I've been struggling with this back pain for 20 years. If only I had that surgery. And if then, a doctor tells you, I'll do the surgery, you'll be fine. Mm-hmm. What are you going to do? Right? It's much harder, and it requires much more empathy and bedside manners and experience and expertise and training and mindset as a physician to then tell those patients, I can do a surgery, right? I'm great at it. It'll be wonderful, but it's not going to solve your problem. It's not going to get you where you need to be. And so that's what it means to find great physicians, is ones, among other things, who can have that level of conversation.
Christoph, I appreciate that perspective, because I think you're right. It takes a confident physician. It takes a confident healthcare professional to make that, or to have that tough conversation where, yeah, the easy road, or maybe the assumption would be surgery, which is costly and oftentimes can lead to a more complex care journey. And so that physician has to be one of excellence to have that conversation and make that other recommendation. So I'd like you to dig in there a little bit, Christoph. How can we do a better job? Maybe how can Carum help avoid, those unnecessary surgical procedures where there might be an alternative therapy?
Yeah, that's a great question, David. I think it's really a combination of two things, right? One is finding physicians that are, left to their own devices would do the right thing, right? That have the right training, the right experience, the right mindset, the right philosophy of how medical care should be delivered. But then you also have to put them into the right environment. You have to give them the right incentives, right? Even the most well-intentioned person, right? If they're trained that, well, if you're doing bad things, you'll be better off, they'll be tempted. And so what the Carum model does, we not only find great physicians, but then we create these economic incentives, the bundles that Brooke talked about, and ways that we can compensate them fairly if a case goes to surgery or not. Right? You want to take the financial incentive out of things where, oh, I'll be rewarded heavily if I'm taking a patient to a surgery. That can even tempt, right, the most well-intentioned person. And so we're dialing that down, taking that out of the equation. And so then if you have great physicians, you pair them up with these incentives. That's how you get to these outcomes where, if a patient comes to us and they've been told you need surgery, 3 out of 10 times they end up not getting a surgery, and they're getting other equally or even more effective treatment that is not as invasive as a surgery, and certainly not as costly.
You said 3 out of 10, so 30% of patients can avoid. That's a huge number, and it's eye-opening. And Brooke, you said it, and I mentioned it too. It's this awareness that there are other options, and the patients don't necessarily think of it that way. And so this is interesting for the patient side of things. Is also it's encouraging to hear how we can align incentives for the physician or the provider community to make these recommendations, and maybe even be more educated on the other options themselves. This has to come from somebody. And I know just from our conversations that Carum's passion and your mission has led to developing these programs, one of which is the Center of Excellence program. And Christoph, I'd like for you to explain and define maybe what kind of provider or what kind of facility do you at Carum consider to be a member of these COE, these centers of excellence?
Yeah, no, this is a fantastic question, David. And I'll, I think I'll first say that, you have to realize that greatness comes from a combination of two things. Right, of course, it's the individual physician, right? They'll have a major impact on how well the procedure is going to go. But if you take a step back, there's a whole host of, if you've ever gone through a medical procedure, there's a lot of people that play a very important role along the way. So it's a combination of the physician, the care team, the facility, what happens before, what happens after, right? That defines greatness. And so for Carum Health, the Center of Excellence really means it is the combination of physicians that have the right training, that have a great deal of experience, that have demonstrated that they don't cause any harm, right? You want to avoid complications as much as possible, and that have also shown that patients actually get better. We've in this country focused very much on the bare minimum, right? Which is, well, let's avoid readmissions. Well, that's great, but if I have back pain, I don't care about readmissions. I care about the back pain going away, right? So in our model, it's also about, well, are you actually getting better? And so once you combine these things and you look at physicians in this way, you look at, well, what environment are they in? What does the care team look like? What does the facility look like? What does the pre-op and post-op look like? Once you combine all of these things, that's how you get to a center of excellence. And, we're very selective, David. We only work with the top 10% of providers in the country. And when you do that, and you also throw in this very strong focus on appropriateness of care, right? This mindset, this philosophy, the incentives we set with our bundle approach, then you get this holy grail of you avoid 30% of unnecessary care or unnecessary surgeries. You redirect patients to the right care. And for those surgeries that do happen where they are, in fact, the best thing for the patient, there's very, very few problems coming out of it, and patients get meaningfully, demonstrably better afterwards. I think that, and then employers and patients save a lot of money. On average in our program, patients save $2,000 in out of pocket. They basically have no out of pocket, and employers save a lot of money too. So this is really the holy trinity, if you will, of you get better quality, you have a better experience, and you also lower cost. And it's just very exciting to be a part of that.
It is exciting. And it's something, we've talked about value-based care. I've been in healthcare the last 12 years. We've talked about value-based care almost since I got into the industry, the profession. But there was always this perceived risk for the provider in a value-based care model. And what you just described limits that risk and absolutely rewards the provider for following this model and following the value-based care methodology if they're doing the right things for the patient and delivering the right level of care for the patient. They're rewarded for that. So correct me if I'm wrong here, but I think the biggest hurdle for value-based care models in the last decade or so has been this perceived risk, and this seems to be addressing it.
Very much so. It's this realization that if you find really good providers for them, it's not that hard to take on risk. And frankly, David, everybody takes on risk.
Yeah.
We had the example of Brooke buying a car. Think about a car repair shop. They take on risk all the time, right? If they don't do the repair properly, they'll have to do it again on their own dime. And somehow this has been absent in the medical profession. I'm actually thankful that this common sense approach is now coming to healthcare. But it's a big change, David, right? It's a big change across the system, and it's a little bit like everybody's still going to Blockbuster when they're streaming available, right? It takes a little while to make that change. And it takes a company that is fully focused on making this change to get people to realize, streaming is so much better than renting a video at a Blockbuster store.
I like that one, because nowadays you look back and go, I can't believe we did it that way for so long.
Yeah.
And I think in healthcare, I believe we're living in this golden age of innovation in healthcare. And I think 5 years down the road from now, we're going to look back and have the same feeling about healthcare. I can't believe we did it that way for so long when, this opportunity was right there in front of us, and now we're realizing it. I'd like to ask another question. You mentioned, with the Center of Excellence program, you're working with about 10%, the top 10% of the providers. I'm actually, I work in Dallas, but I live about 70 miles outside of Dallas. I'm in a rural community, a long ways away from, any provider. Probably not one that is a part of that top 10%. Does working with just the top 10% of the providers limit access for our patient community? And if not, if that's accounted for, tell me how Carum adjusts or accounts for that limited access potential.
Yeah, I wouldn't call it limited access, David. It's the question of, you have a restaurant across the street, but the food's really bad, right? You get food poisoning every other day if you went there. And if I told you that well, David, it's a lot better if you hop into your car and drive 10 minutes down the street to a much better restaurant. By the way, it's also cheaper to go there. You don't get food poisoning. It's actually a wonderful experience. Could it potentially bother you to do that? People do that all the time, right? And somehow we have this understanding in healthcare that it works different from the rest of the world, in that, oh no, I'm supposed to have the highest quality, the best of the best, the most experienced people, across the street from me. And I think that's not realistic, right? I think if it's, going through a major procedure, right, something that will have an impact on you for the rest of your life, that can, if it goes wrong, it can really go wrong. Right. You could potentially, you can die if it's not done properly. I would argue that, if you live in a rural area, or you live in an area where there isn't a high quality around, hopping in a car, driving a little bit, I think everybody will be better off.
Yeah, well said. We don't think of other areas of our lives as apples to apples. You don't say that this restaurant is the same as that restaurant because they're a restaurant. But oftentimes in healthcare, we say, well, there's a hospital here and there's a hospital 30 miles away. They're both hospitals. I'll just go to the closer one, or I'll go to this provider because I don't have to drive as far. When in reality, through your research and the work that you guys are doing at Carum, you guys are identifying the providers that, are qualified to be in these centers of excellence. And then you're just educating not only the patient, but the employers on the right choices to make for their care.
Yeah. It's such a no-brainer, right? It's like, it's a little bit like healthcare is where we were in restaurants before Yelp came around, right? You relied on your friends and family and telling you which is a good one. It's like, oh my gosh, this might be okay if you're going out for dinner, but if it's a life-altering operation, you want to be a little bit more precise about it. And I'm just excited that there is a way to do this, right? That we figured out a way to do this. There's a lot of investment, David, we make. We buy a ton of data. We visit these providers. We walk the halls. We talk to them, and put them under the microscope, so that at the end of the day, we just make it easier, right? I don't think it's not that people don't want to pay more attention. It's just so incredibly hard to do. And right. Brooke just gave us the example, right? Even if you want to, how do you find that information? And that's really the public service, if you will, that we provide, where we do the hard work of digging and digging and digging and coming up with, here are the best of the best, present them on a silver platter, and by the way, you're not paying anything. And the employer, you're saving upwards of 45% on these procedures. I mean, what's not to like?
Yeah. Okay. So you touched on something that's great. And by the way, I love, I had a podcast not too long ago where the guest on the show said it's hard to change patient behavior. It's like herding cats sometimes, but if you want a cat to go somewhere, you just move the food and they'll show up there. And then this example, you're moving the food a little bit so that the patients know where to go, and that behavior can change for the betterment of their overall health and the outcomes of their care journey. But the other thing that you mentioned was, we've talked about the patient a lot, which is important and probably the biggest community that we serve here on this podcast. But this has a great impact on the employer as well. And Brooke, I'd like to get your opinion. How does this value-based bundled approach impact the employer? How does it benefit them?
Yeah. Well, as you probably know, an employer's largest spend is going to be compensation and benefits. Number one spend item on any spreadsheet for any company. And surgical care, complex care, cancer, it accounts for roughly 50% of any employer's overall healthcare spend. And the Carum program, we significantly reduce spend and almost cuts it in half for the employer. I think Christoph mentioned it, but we were validated recently by the Rand Corporation that we're saving employers greater than 45% on a per procedure basis, which is, this is your top spend, and it accounts for about 50%. Surgical and complex care is accounting for about 50% of your overall spend. This is significant. It has significant positive financial impact for employers. They also don't mind the fact that they get to provide appropriate care for their population. I mean, can you imagine if, 25, 30% of surgeries are unnecessary, and as an employer, you're paying for that. You're enabling that to happen. I mean, these are human beings who are, taking time off from work, inconveniencing their families, their friends, and are getting cut by a knife and being put under anesthesia unnecessarily. So if you know that as an employer, and you can do something about it and provide the most appropriate care, wouldn't you want to? And then just, over the overarching thing here of, being able to just provide the highest quality benefit to your population, knowing that you're sending your population to the very best of the best, who are not only vetted, but willing to sign up for a warranty such that if there is a readmission, 100% of the expense is on the provider. That's somebody who any of us would be more than happy to send our friends and family to. And so as an employer, to be able to provide all of those things and have that kind of an impact, it's just huge.
Especially in such a highly competitive hiring environment now, you think about the benefits that you can give your employees. This is one of the best. So it could be a differentiator there. But I also see, the financial side of this is obvious, right? If it's 45, if you can reduce that spend by 45%, obviously you're helping the business in a big way financially, but there's a return to work process too and timeline that gets greatly improved for those employees that don't have to go under the knife, because then that means they're probably recovering faster and are able to return to work more quickly, which then benefits the business and the employee on a whole different scale.
Could not agree more. The downstream impacts of this model for an employer, it's just significant. I mean, it really results in a no-brainer type of decision.
Yeah, I mean, it's checking all the boxes, right? I mean, if you do have to have surgery, it's going to be cheaper by a lot, almost by half. And then let's avoid surgery if at all possible, and then get you the access to the highest level of care, highest level of provider possible through our navigation. I mean, you're right. It feels like the best of all worlds for the patient, the employer, and the provider. And I don't want to put you on the spot here, but I would like to ask about, this topic of consumerism that we see so much in the news around healthcare, where, patients are becoming more of a consumer of their healthcare. They're more educated, more aware of the options and choices that they have. A model like this almost breeds competitiveness by the provider, right? It almost breeds competition, because if there's a 10% of providers that are meeting these qualifications and requirements, if I'm a provider that's not in that 10%, I'm looking at my own business saying, how can I get there? And I'm looking for ways to improve the care that I deliver. Is that something that you guys have seen?
Oh, very much so, David. And in fact, we're big believers in, bringing market forces to healthcare in this kind of a way that hasn't been, right? It's always been a free for all. We go to, any hospital can do everything, and there's no real competition on quality and on cost, frankly. We are changing that, right? We are using market forces to drive improvements. To give you a very concrete example, a provider we've been working with in the Northeast, well-known system up there. We only took half of their surgeons into our program. And they were, they didn't like that. And you can imagine the surgeons were not happy about that either. And so, we sat down with them because they wanted feedback. So we walked through what the problems were, right? High readmission rate, infection control not working properly, et cetera, et cetera. And so then a year later, so we give every provider a chance to come back a year later, and we recertify the ones that we have, but once we said no to, they can reapply to Carrum Health. And so there was this one surgeon from the provider, they did, and the data was almost night and day different. And I said, wow, how can this be? So I sat down with the surgeon and asked him, what happened here? I think the readmission rate went from 12% to 2%. And I said, there's no way. How can this possibly happen? And they said, well, you forced us to pay attention to it, right? And so we looked at why were these things happen? But the things that are, you expect people to do normally, right? Well, why do they happen? Okay, why is infection control not working properly? What are the other surgeons doing that are better in the same facility? And so that really forced that sort of permeation of knowledge and experience. They changed, they hired a new physician assistant, made a bunch of other changes, and they got better. And that's the other beauty of the model, right? You always ask yourself, well, how can you actually foster change? This is the model, right? You use market forces, they're very powerful, and people will actually change and they will get better. And that's what I'm very excited about, because this is a very powerful way to do that. You don't have to cajole physicians, right? It's the carrot of the business that'll drive them to make the change. It's a very powerful incentive.
I agree with that. I can imagine that. And just knowing the few physicians and providers that I know personally, they're very competitive people, and they want to be excellent. Sometimes you can't manage almost all the time, you can't manage what you're not measuring. And in this way, you're providing the measuring stick.
Yeah. Physicians are very, very smart people, right? There's very smart people in the healthcare industry, beyond physicians too. But we haven't set up the right incentives, right? We've been paying them in a fee-for-service model. You do more, you get paid more. We don't really force any competition about quality. We hide quality there. We don't really show you. And well, that's what you get, right? It's not surprising. And so once you bring these right incentives in place, these very smart people will come up with really, really good solutions.
Well said. We've talked about a lot today. Brooke, I'd like to start with you. If you could reiterate one fact that we discussed today, or maybe mention something that we haven't talked about. If our listeners could walk away understanding one thing, Brooke, in your opinion, what would that one thing be? What's the most important thing that they walk away understanding?
I would say healthcare isn't broken. It's the business model of healthcare, the fee-for-service model, that is no longer serving, and that we deserve more. People deserve more. They deserve better. Similarly to how we no longer look to Blockbuster for movies and shows, we need to demand something better, something that optimizes the cost, quality, and experience, really for the patient, provider, and the employer. Well
said. Christoph, same question.
Yeah, I think it's really we actually have the power to make this change, and we have the tools to make the change. It's not an easy road, but it's a very rewarding road. And I'm just excited that, to stay in the analogy, we finally started to do some streaming in the healthcare industry.
Well said. Well, listeners, it's obvious why I was excited to bring Carrum Health on to the show. Access, experience, outcomes. A lot of this can be aligned and improved through a different model. And value-based care, although we've talked about it for a long time, is getting to the point now where we're starting to see the benefits. Our patients and our providers and our employers are starting to reap the benefits when following that structure correctly. And so, Brooke, Christoph, I can't thank you enough for being here, sharing your story, sharing the updates and the impact that you're making in healthcare. And I wish you all the best.
Likewise. Thanks for having us, David.
Thanks for having us, David. Real pleasure.